Hello, welcome. The purpose of this segment is to go over the Orange County's use and the guideline for lactate testing in EMS. This afternoon what we're going to do is we'll go through several things. We'll go through the Lactate Pro machine itself, its actual physically how to operate it. We'll look at several other things. We'll review the clinical indications for the use of the machine. As I said, we'll go over testing and calibration. And we'll talk about serial testing, which is one of the things that if you choose to use this machine, you should do. One of the things we want to make very clear is that this lactate testing guideline is not to be confused or equated with lactate and sepsis. I think probably to the great credit of the Surviving Sepsis campaign, a lot of people nowadays are equating lactate testing with sepsis alone. This is not the way we use it, and this is not the way lactate testing should be used. You test patients who you have a suspicion are or may not be meeting their metabolic needs. Now, we've gone over this in previous presentations on lactate and lactate testing in EMS, and you can certainly look at them, and I would recommend that you do. But we'll touch very briefly as an overview on some of those things. If you remember from before, we discussed SIRS, the Systemic Inflammatory Response System, and we talked about the criteria and the parameters of what you need to have the patient included in that SIRS criteria. And of course that criteria is a temperature that's less than 36 degrees centigrade or greater than 38, and that transfers into Fahrenheit. That it's 96.8 or 100.4 Fahrenheit. They have a respiratory rate that's above 20. They have a heart rate of 90 or above. Now there's two other values at the end of the SIRS criteria that are worth mentioning, even though you don't really ever get them in the back of an ambulance or in normal EMS practice. And that's a white blood count that's less than 4 or 4,000. Or greater than 12 or 12,000, and those two things can be expressed either way. And the final one is a PaCO2 that's less than 32. And the reason that I mention that is there may be times where you're going to go to a facility that has the ability to do some lab testing or some diagnostic testing before you get the patient. And that's why it's always a good idea if you go to a clinic or whatever it is, just routinely to ask, hey, have you done any testing or any lab work? And they may well have done it, and they're not expecting you to ask for it, and that will give you some additional information into your patient. Now, also on the converse end, on the trauma and the extremely sick trauma patients, we'll go very quickly over the guideline that we use here in the county. You should all be aware of it, but it's worthy of going over again. And we just use the CDC's injury prevention, and it states that they recommend that you bring to a level 1 trauma center or the highest level trauma center that you have available to you. Patients that have a GCS of 13 or less, they're breathing less than 10 times a minute, greater than 29 times a minute. They have penetrating injuries that are to the neck, torso, or they have penetrating injuries to their extremities that are proximal to the knee or the elbow. They have any form of chest instability. They have 2 or more proximal long bone fractures, obviously pelvic fractures, amputations that are proximal to the wrist or the ankle, obviously open or depressed skull fractures, and paralysis. So those are the obviously very, very sick people that I would presume would always consider bringing to a level 1 trauma center or getting them to that type of a facility however you could. The other patients, the CDC's guidelines, apart from them, consider it appropriate to bring to a level 2 or whatever's available to you. So that's what we're going to basically go over here. And then we'll go through the actual operation of the Lactate Pro machine itself. It's worth saying that this machine is FDA approved for its purpose, and there is a CLIA waiver to perform this actual test. So several of the things you have to do. If you've decided that you're going to use this test, like all tests, one test all in and of itself is of very little use to you. You have to do serial testings. So what we would like for you to do is if the patient is in your care for 20 minutes or greater, repeat the lactate. So you'll have at least a baseline of where they started off, where they presented first, and you've initiated therapy, and where are they now? So remember when you do that, that you don't report one value to the receiving facility, that you report the initial value, the therapy that you've provided, and what that value is now. So I'd like to deal a little bit with the meter itself and how you actually operate it. We're using the Lactate Pro, which is a FDA approved and CLIA waived form of testing for lactate. It has some unique things about it that you need to know, particularly about the machine and also in how you collect the sample. For the purpose of this presentation, we're going to go through the actual practical use of it in the back of an ambulance. Any of the functions of this machine can all be found in that book that's in the back of the actual pouch itself. All right, so now what we'll do is we'll just go over the typical setup and the things that you should actually expect to find in this little pouch when you open it. The things that are arranged here are typically what you would expect to see, no different than you would see it in a blood glucose testing monitor. Important things for the Lactate Pro is this particular thing here. This should always be in this bag to protect it from getting contaminated. You'll find a very small strip, and then you'll find in there the sticker that tells you what this should come out to be. So it's a check or test strip. So if this is functioning properly, we should have 2.1 to 2.6 millimoles per liter. And this is how this machine expresses it, 2.1 to 2.6. Other machines may express it as 19 to 23, and it may do it in an expression of milligrams per deciliter. So in order to, when you're starting off with this machine and when you're practicing with it first, to get used to it, you take out the strip. You'll see it has a green end on it there. This is the testing end with the two electrodes on it. Take the machine, no different than you would do in a blood glucose. Insert the strip. And you'll see on here that it says that it's 2.3. So you know that the machine is working within the normal calibration of the machine. And that's very simple. What's important, though, is that when you're finished with this, you put it back in this container. If the electrodes on this little testing strip get contaminated, it's going to affect the test that you get. You'll have an erroneous test. Now, the other thing when you're talking about testing versus calibration, as I said earlier on, they're two very distinct things. These are the test strips. They don't come in the bottle that you normally see glucose testing strips come in. This is what you'll see them in. And they're gathered together. There's an important thing with this here. When you take them out, they'll be bound together like this. But somewhere in every one of these strips, you'll find a similar testing probe. This is the calibration test for the machine. As I said, this is test, this is calibration. And what this does in the test, it says the machine is working within normal parameters. This calibrates the machine to work with these individual strips. So what you need to do when you change out your strips, you must use the calibration that comes with the machine. Now it's very hard to see here, you may be able to see it, but on that it says F5. If you look on the back of the testing strips, F5 is displayed here. So this F5 is married to this F5. And you use it in the exact same way as you did the testing strip. It has a green dot on the end that stays to the outside. You insert it in, it'll beep, and you hope that it comes up with F5. So now we know that the machine is working within normal parameters, and it's now matching the strips that we're going to use. So those are the basic functions of this machine. As you can see, you don't need to turn the machine on. The machine activates as soon as you actually put a strip in it and turns off rapidly afterwards. So the process of actually doing a test is no different than the tests that you would normally see for glucose or anything else like that. There are some important things that you need to note about this, and we'll take one of these strips out and we'll do a test just as a demonstration. It is very important that the area that you're going to test is clean. So what we suggest you do is do this, no different than you would open a needle for a syringe. prepare it like this and hold it like this so you don't risk contaminating anything. You do the normal preparation that you would. You clean the finger. Now here's the important part. You have to remember to dry the finger off. You can't have residue and contaminants from the environment on the finger. So it's important that you dry off the finger. Now, if you don't have a finger available to you, you can use the earlobe just as good. It's just as good for taking any form of capillary samples. So you go ahead just as you normally would do, and you prick the finger. You get your blood sample. Once you know that you have enough blood, insert this into the machine. Oops. Now, when you put the blood in the machine, you do not want to put the blood on top. The blood goes on the end like this, and you'll see it fill up. It will beep when it's full. You should see the blood go all the way up. And then it will count down the 60 seconds. It's predictably 60 seconds. You're not going to get a test before or after it, and nothing else you can do but just sit around and wait for the 60 seconds. In the meantime, you can take care of the finger. So we count down the last couple of seconds here, and hopefully my lactate is normal. So my lactate is 0.09, an entirely normal number. The machine will alarm if the lactate is over, I believe it's 23, but to be living and actually metabolizing with a lactated 23 would be very hard to do. As I said earlier on in the presentation part, this machine will store this if you wish. We don't normally store them because, generally speaking, we don't see those patients again. But for athletes and runners and people who use this machine maybe multiple times a day when they're training, they want to know a trend in their lactate, so they will store it. But for our purposes, there's no reason to store it. And the other thing with this is once you take this out, the container you took it from is a very good way, if I can get it right, it's a very good way to store that, and you put it away in your contaminated area, your sharps or whatever you have. So, just to review what you should find in here. The meter, the product manual, and then you will have the check or testing strip. Remember, they're different from the calibration strip, as I said before. This tells you that the machine is working within normal parameters. And you check it about once a month. This is the manufacturer's recommendation for this. So you check the machine once you start off about once a month. You will also have, with each set of strips, each new set of strips, you will have the calibration chip. And the calibration chip, remember, if you remember, on the back of it, displays an F number, F5 in this case. Each strip that you're using, and you need to assure that there hasn't been a mix-up, this strip here should say F5. And it clearly does. So F5 and F5 go together, and this tells you that the machine will be reading this particular set of strips correctly. So you have the test strip, you have a calibration strip, and you have the actual test strips for the patient themselves together with the machine. And then everything else is normal equipment that you would have for taking any capillary blood sample. So, in conclusion, we've talked about the guidelines, we've talked about the clinical indications, we've demonstrated and talked about how to use the Lactate Pro itself. Just to review some of these things that we need to remember. We're going to use this for patients where you have a suspicion of the patient not meeting their metabolic needs, for whatever reason that may be. It may be from cardiac origin, it may be pulmonary or respiratory in origin, it may indeed be sepsis. But please don't guide yourself or limit yourself to sepsis only. We'll remember that we're going to do serial testing. If you decide that this test is clinically appropriate to use and you decide to use it, having that one test gives you a starting point. You have to track that value. So obviously when you give your report to your hospital, you will have the initial test, you'll describe the therapy that you've given to the patient, and then you'll have the new value to see how that therapy has or maybe has not worked very well for the patient. And you'll make sure that you document. It's very, very important that you document both those values in the actual patient care report, both in the written and in the final product, the electronic report. The hospital will use this. Various hospitals will use it in various ways. Some hospitals around here have said that they will include it in some of their alerts, so to speak, a trauma alert and whatnot. Other hospitals will be slow to use it, and there may be times where you feel that you've gathered the information to no real avail. Just remember that this is something, like a lot of other things that we've done, that is new to the area. A lot of other things took a while to get accepted and be assimilated into the normal practice. This is no different than any of them. So get your lab value, or get your value from here, documented well, and at the start of this program, don't be too worried about what the receiving facility chooses to do with it. So we've covered a brief synopsis of all the things that we'd like you to do, together with the testing of using the machine itself, how you physically test it, the clinical indications. We've gone over serial testing. Remember that we want you to test the patient initially, use the therapy that you've decided to use, test the patient again to see how that has affected them for good or for bad. And we also need you to document that and report that to the hospital. For some of you, you may not be that familiar with the SIRS criteria, and I'd encourage you to look at a 3-part video that we did here at the department on the use of lactate testing and the utility of lactate testing. This and all the videos we do are always available in 2 places, or actually 3 places. One is County of Orange Fire and EMS on Facebook, and on YouTube you can search under COFEMS videos. COFEMS is capitalized and videos is in small case, and that's all one word. We also encourage you to visit our partner, which is clinicalbraintraining.com and fire-emsbraintraining.com. If you have any questions or you'd like a copy of this, you're more than welcome to email me at videos@orangecountyva.gov. Thank you.